The pulse can tell us much about what is happening inside the body. When the heart contracts, blood circulates through the blood vessels of the body in pulsating waves. This wave, known as the pulse, can be felt as a light tap. The pulse can be palpated at several sites. The most common site is the radial pulse, which is located on the inner aspect of the wrist just below the thumb. When measuring the pulse rate, you should also assess the rhythm and volume of the pulse. Alterations in any of these can indicate health problems. Sanitize your hands before proceeding. Greet the patient and introduce yourself.
Hi, my name is Kim, and I'm going to be your medical assistant today.
Identify the patient and explain the procedure.
Hi, Christina. How are you doing today?
Hi.
I need to take your pulse. Is that okay?
Observe the patient for any signs that might affect the pulse or respiratory rate. Position the patient's arm alongside the body in a comfortable position. The forearm should be slightly flexed in order to relax the muscles and tendons over the pulse site. This makes it easier for you to palpate the pulse. Place the pads of your fingertips over the radial pulse site. The radial pulse is located in a groove on the inner aspect of the wrist just below the thumb. Never use your thumb. It has its own pulse, and you may end up measuring your own pulse instead of the patient's. Apply moderate, gentle pressure directly over the site until you feel the pulse. If you cannot feel the pulse, you may not be palpating over the correct site. Try moving your fingertips to a slightly different location in the groove of the wrist. Another reason for not being able to feel the pulse is the amount of pressure you are applying with your fingertips. If you are not applying enough pressure, you will not be able to palpate the pulse. On the other hand, you may be applying too much pressure and closing off the artery. Try varying the depth of your hold until you can feel the tap under your fingers. Use a watch with a second hand to count the pulse beats for 30 seconds and make a mental note of that number. Determine if the pulse rhythm is regular or irregular, and if the pulse volume is normal, thready, or bounding. If you discover abnormalities, continue to count for 1 full minute. This gives you more time to fully assess the abnormalities. After taking the pulse, continue to hold your fingers on the patient's wrist with the same amount of pressure and measure the respirations. This helps to make sure the patient is unaware that you are monitoring her breathing. If the patient is aware that her respirations are being counted, she may change her breathing pattern. This results in an inaccurate measurement. Observe the rise and fall of the patient's chest as she inhales and exhales. 1 complete respiration includes 1 inhalation and 1 exhalation. Count the respirations for 30 seconds and make a mental note of this number. Note the rhythm and depth of the respirations. Also observe the patient's color. If abnormalities are noted, count the respiratory rate for 1 full minute. If you counted the pulse and respirations for 30 seconds, multiply each of the numbers counted by 2. This will give you the pulse rate and respiratory rate for 1 full minute. Christina's pulse rate for 30 seconds was 38. Multiplying this by 2 means her pulse rate is 76 beats per minute. Christina's respiratory rate for 30 seconds was 9. Multiplying this by 2 means her respiratory rate is 18 respirations per minute. The normal resting pulse rate for an adult ranges from 60 to 100 beats per minute. In a healthy individual, the rhythm should be regular and the volume should be strong. The respiratory rate of a normal healthy adult ranges from 12 to 20 respirations per minute. In a healthy individual, the rhythm should be even and regular with a normal depth. Sanitize your hands. Chart the results. Include the date, the time, the pulse rate, rhythm, and volume, and the respiratory rate, rhythm, and depth.